Hello, so today I'd like to make a very interesting video about exercise and its relation and association with anxiety. And so, anxiety is governed by the emotion of fear with physical symptoms of racing heart rate, sweating, chest pain, panic attack, tension, jitteriness, shortness of breath, and even being more alert and focused. So, anxiety is both a combination of these physical symptoms and the emotion of fear. It is part of the stress response in response to a threatful situation or event. The problem is that in anxiety disorder, when you feel anxiety, there is no threatful situation. So your brain is unable to distinguish between danger and safety. And some forms of anxiety include generalized anxiety disorder, social anxiety disorder, panic attacks, and even specific phobias when you fear specific things like spiders, crowded places in agoraphobia, for example, heights, etc. So anxiety disorder can lead to one another. So for example, you can go from one to the other. And also they can lead to depression. People with any of these anxiety disorders are at much higher risk of also getting depression. And also a low anxiety threshold. So people who have a low anxiety threshold, meaning they get anxious more easily, can make these disorders, of course, even worse because of the constant worrying and fear, right? And of course, a lower self-esteem to control the anxiety can also make things worse when you feel less in control. So exercise can actually help you better control all of these things, okay? So exercise can put you in a situation where you have better control over your anxiety symptoms, just like we saw with stress in the previous videos. And it can help you stop worrying about these things that you're worried about. And it can also increase your motivation and self-confidence to engage in things that life has to offer and lower your anxiety threshold to stop anxiety from taking hold on you. So it can make you kind of get out of your shell, but by increasing your motivation to do other meaningful things and to really get out into the world, as you'll see later, it can increase your self-esteem and make you more confident. This is a form of active coping because it allows you to interact with the world a lot more rather than staying in your shell and passively worrying about things. So it's a great form of distraction, as you'll see in just a moment. So exercise reduces physical symptoms of anxiety, and intensity has been shown to matter. So the more intense the exercise, the more the physical symptoms go down. It literally makes you get used to the physical symptoms of exercise, of anxiety, because when we exercise, we experience similar symptoms like elevated heart rate and rapid breathing. And so you gain more control over it, and you form cognitive restructuring, which also changes the trait of the anxiety, of the fear. So you not only reduce the physical symptoms, but the fear goes down as well. It is like a form of distraction. It makes you more resilient as you realize that you can actually do something and control it. So here's the science behind reducing the physical symptoms. Exercise helps reduce resting tension in muscles, specifically the electrical sensation activity in the muscle spindles goes down. So by reducing the tension in the muscles, you send a signal back to the brain saying everything kind of is there's no danger, right? So it makes you more calm that way. It also increases fatty acids in the blood, and this actually causes these fatty acids to compete with tryptophan for a binding site, right? So instead of having tryptophan as a partner, they have these fatty acids as a partner. So essentially they instead of fatty acids binding to so fatty acids bind to the receptors instead of tryptophan. And so you increase tryptophan in the blood, then the tryptophan goes to the brain, and higher levels of tryptophan in the brain, so it crosses the blood-brain barrier, tryptophan makes serotonin. So essentially what I'm saying here is that by raising these fatty acids in the blood, the end result is to get more serotonin in the brain. And BDNF, also produced during exercise, also helps increase serotonin levels in the brain. Why is higher serotonin level in the brain good? Because it helps calm us down and it gives us a sense of safety. It also helps the prefrontal cortex literally shut up the amygdala from initiating the stress response. So by exercise, you're boosting serotonin levels. That's point number 2. So point number 1 was you reduce muscle tension, and point number 2 is that you're boosting serotonin levels, which calm you down as well and prevent you from initiating that anxiety, initiating that stress response, right? That can lead to anxiety. And the third thing is that when you move the body, you're actually producing GABA and you're producing ANP, a very important molecule. So both of these help quell the stress response as well. As you'll see later, ANP is generated by the heart contractions, right? So literally, there's a link between the heart and the stress response and anxiety and panic attacks. You'll see later that when you exercise, your heart rate increases and that helps generate ANP through muscle contractions of the heart specifically. So this is the science for the physical symptoms. What is the science behind the fear of anxiety? How does exercise help reduce the actual fear portion of anxiety? Well, because all of the above, you actually feel less anxious as well, right? Exercise, as I mentioned, helps increase GABA and BDNF, and these actually help reduce the fear response as well, and reducing muscle tension helps you reduce the fear response as well, because you are actually making your body, by making your physical symptoms, reducing the physical symptoms, you're making yourself more calm. The feeling, of course, goes down as well. So exercise actually also helps you form new connections and positive connections to create a detour around the fear so you can better cope with it. And Ledoux in 2001 in the American Journal of Exercise, he actually published a very interesting study, and it was called Overcoming Anxiety Through Active Coping. He showed that exercise helps you form new connections, and literally shows that there's a shift of signals from the central nucleus of the amygdala to the motor circuits in the basal nucleus. So there's an activation in different parts of the amygdala, which goes from the fear response or from the fear pathway to the motor movement pathway. So we don't associate a non-threatening stimulus with a really threatening one. So essentially you're rerouting pathways and connections in the brain from something that's negative and fearful, part of the amygdala, to a different part of the amygdala, which is more like a motor pathway, which gives you more positive memories. So that's how it helps. It reduces those fearful memories, okay? And this is again a form of active coping, and is much more effective than sitting down and worrying, because that activates the fear pathway of the amygdala, which we don't want. Okay? And of course, exercise helps set you free, as I mentioned, helps you explore the world and interact with people. It's a form of active coping. And active coping is great, as I just mentioned, it shifts the pathway. It's a form of cognitive restructuring. So on top of all of the above, which helps reduce the physical symptoms and of course the fear response, you actually get a shift, and GABA and BDNF also play a role in rerouting and forming new memories and associations that go around the fear. You form this kind of detour. Okay, so just to recap, exercise helps reduce the physical symptoms of anxiety, literally less tension in the muscles, more serotonin in the brain. You make these GABA and ANP, which quell down the stress response and make you more calm and safe, etc. But you also actually feel less anxious as a result of the anxiety, and you have a rerouting or a shift in the neural pathways and connections to reduce the negative, fearful memories that are associated with you feeling really, really anxious, and maybe even giving you panic attacks, etc. So you literally get a reshift in the brain. So so exercise doesn't only help you with the physical sensation in the body, but it also plays a huge role in the brain and in the mind as well. And in the 1970s, unfortunately, we mainly relied on medications like imipramine and beta blockers. And back then we thought exercise, especially in the 1960s, that it mimics anxiety symptoms and lactic acid, so it must not be good for us because you're increasing the symptoms of anxiety. In fact, most of the older studies from 1960 to 1989 were discounted because they were not good enough in terms of study criteria. They were not double-blinded. They didn't have like the control, the placebo thing, right? So they were not good enough from a medical standpoint, and so they're just discounted. And even in 2004, a study in the New England Journal of Medicine published a review of treatments for generalized anxiety disorders, and all were drugs. In fact, 13 of them to be exact with therapy and relaxation also there, like talk therapy, etc., and relaxation like visualization and deep breathing, for example. But exercise was not mentioned. But later, a letter by cardiologists in New Orleans showed that that the 2004 review, that same review, missed the boat, and it didn't. And exercise does in fact help reduce anxiety symptoms. And Levy wrote many papers, in fact 70 of them, as I mentioned, he's a cardiologist, on how exercise is good for the heart and for anxiety. In fact, many papers in the 2000s showed a link between ANP, which is released during exercise, and in the heart actually suppresses the HPA axis associated with stress, and that showed a link between the heart and stress and panic attacks. In fact, they injected, I think it was rats or mice, in one study in the 2000s with a compound that induces the stress response, and they showed that this ANP molecule, either by injecting it directly or having the rats or mice or some rodent exercise to generate that ANP, and that ANP actually helped quell whatever was causing the anxiety and the panic attacks. So you can see that the heart, actually, there's a link between the heart and the anxiety stress response. So cardiologists actually picked up on that in the 2000s, as you've seen, and Levy actually had many papers on that, which showed that actually cardiologists were ones to show that yes, exercise is definitely good, not only for the heart, but actually also good for the anxiety and panic attacks, which of course makes sense. They also show that those who exercise, by reducing the anxiety response and panic attacks, you're also actually generating better outcomes for people with heart failure, for example, and people with heart disease, because of course anxiety and panic attacks can make heart conditions a lot worse. And so that field picked up on that in the 2000s really quickly, and of course the author mentions in the book, John Rady, that the best thing to do is actually to combine medications with exercise, but not medications alone, because medications are a short-term kind of help for anxiety. If you have a really strong panic attack, they can help kind of diffuse it, but then exercise actually helps maintain long-term results. And actually studies in the 2000s, actually that's what they showed. They showed that exercise is better long-term, right, than just medications, or maybe at least as good. But the benefits of exercise is that it also helps you gain more control over the stress response and anxiety, something that medications don't allow. It gives you that more active coping, and it's long term because of that rerouting neural associations, as I just mentioned. So exercise is great if you're feeling anxious. It literally is a form of distraction. It makes you more resilient because it makes you seem like you actually can control and do something about it actively. It actually physically reduces the symptoms of anxiety, and it also reduces the fear of anxiety by rerouting neural association away from the fearful memories.